It's important to acknowledge that Ebola is really quite a frightening disease, but it's also important to know that here at the Ministry of Health, along with our colleagues in the health sector, we're working really hard on planning and preparation so that in the unlikely event of somebody coming to New Zealand with Ebola, we can actually manage it very effectively. Our assessment is that the risk of Ebola arriving in New Zealand is very low, and that the risk of actually having transmission of Ebola within New Zealand is extremely low. Really, since August, we've had enhanced border security or border surveillance in place. It's important to note that we have a lot of existing protocols for managing ill people who arrive in New Zealand anyway, and really what we've been doing since August is just an additional level of surveillance for people who've come from those countries that are affected by Ebola. It's likely that we will see a patient who we need to test for Ebola, i.e. they have suspected Ebola, but they're much more likely to have some other condition such as malaria.
It's one of the big issues around West Africa is that there's almost no public health. There's also almost no clinical medicine provided, and therefore patients were in the community being treated and dying and then being buried in a way in which they were exposing lots of people. It really spreads in an environment where there is a total lack of public health, a lack of basic hygiene in terms of medical hygiene, and that is not the scenario here. History has told us that previous outbreaks in other parts of the world, and in Africa especially, have actually been managed by putting in very simple and basic control measures. Those control measures are part and parcel of the way in which we work in a country like New Zealand.
It's really quite difficult to catch Ebola. You catch it from the body fluids of somebody who is actually infected with the disease and is unwell with it. You can't catch Ebola from simply sitting next to somebody who is well and incubating Ebola. I think it's really important that people are aware of the work that we're doing in terms of planning, preparation and support for the health sector. We're working very closely with DHBs, hospitals and primary care, providing with regular updates on how to be prepared for Ebola. We're coordinating the New Zealand's preparation, not just with the health sector, but also across a whole range of government agencies who can be involved.
We need to solve the problem at the source. We need to stop it spreading within West Africa and to other countries. Like all patients, Ebola patients must be treated with dignity and respect.